Good afternoon. This is a North Andover Board of Health's virtual meeting, Tuesday, October 27th, 2020, 5 p.m. I'm Joe McCarthy, Board Chairman. We do have a quorum, and let me go over members of the Board of Health that are here right now. Michelle Davis, Clerk, Dr. Patrick Scanlon, Dr. Max Tilson, and me. Also from the Board of Health is Brian LaGrasse, Director, Steve Casey, Inspector, the town nurse, Carol Emerson. Is she with us?
Nope, she's off for a few days, remember?
Okay, and Tony Wolfenden. Before I begin, I have to go over and recite the governor's statement on the coronavirus. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law and the governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the North Andover Board of Health will be conducted via remote participation to the greatest extent possible. Specific information in the general guidelines for remote participation by members of the public and/or parties with the right and/or requirement to attend this meeting can be found on the town's website at www.northandoverma.gov. For this meeting, members of the public who wish to watch the meeting may do so on the television by tuning to Comcast Channel 8 or Verizon Channel 26, or online at www.northandovercam.org. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately assess the proceedings in real time via technological means. In the event that we are unable to do so, we will post on the Town of North Andover website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible after the meeting. If the public would like to participate in public hearings, please email your question, comment prior to or during the meeting to blagrasse@northandoverma.gov. That is BLAGRASSE at northandoverma.gov. The question comment will be read during the proceedings and responded to accordingly. This is a special Board of Health meeting. The regular monthly meeting was held just 5 days ago. And the prime purpose of this meeting is to discuss the town's memo on mandatory participation in infectious disease isolation, quarantine, and contact tracing. This is written primarily by Brian LaGrasse. He's the director of the Department of Health. And this is a town, or will be a town regulation. And as such, after presentation and discussion, the regulation has to be approved by the Board of Health. After this approval, there'll be an update and discussion on COVID-19, then the meeting will be adjourned. So it should be a relatively short meeting. Brian, in that this is a virtual meeting, please read and discuss this memo on mandatory participation in infectious disease isolation, quarantine, and contact tracing. It's all yours, Brian.
Well, I thank you, Joe. Let's see, just give you guys a quick little update. As of Sunday night, last time we ran the numbers, we've got we had a total of 46 active cases in town. 13 or so were from Merrimack and 33, or give or take, were from town residents in here. So we've seen a little uptick in the past couple of weeks. We've seen things go up since the end of the summer and into the fall with, more people being out and about and more interaction, things like that. So I think people are still getting a little complacent. We've seen the numbers go up markedly over the past couple of months. But they're still not bad. So we're designated as a red community still. That is due mostly in part to having the Merrimack College numbers onto our town numbers. If the Merrimack numbers were included, we would still be a yellow town. But regardless, we have gone up to that point, and we have got that threshold where we are red. And if it keeps going the way we're looking at right now, we'll be a red community anyway without Merrimack. So we want to just remind people to stay safe and do what they're supposed to do with limiting their gatherings, how much they go out with, who they go out with, how many close contacts they have, and things like that. So that essentially is my PSA for the day. The next thing I will discuss is our new local regulation. So, Joe, what this is the state has a regulation for isolation and quarantine that is performed by the local Board of Health and the Health Department. And in those regulations, they don't give you any or give us any type of enforcement actions or criteria in terms of fines or any type of enforcement tools aside from passing your own local regulation. So, with that being said, and knowing that some people that have had issues with either staying on isolation or not wanting to quarantine, or even organizations that we try to work with to get their close contacts, such as a league sports team of some kind, that the coach may have a roster and may give us some pushback on giving over the roster so that we can talk to and reach out to all of the members of that organization to determine who is a close contact and who needs to quarantine for 14 days. So getting a little pushback on that a couple weeks ago, kind of brought this up, and we discussed it as a department in here and decided that the best thing to do moving forward to make sure that people do comply with at least cooperating with contact tracing, and if they are in isolation, staying in isolation, or if they're quarantined, to stay in quarantine. So what this is pursuant to the provisions of Chapter 111, Section 31 of the Mass General Laws. The North Andover Board of Health can adopt regulations to basically augment other types of regulations that the state has. And this is promulgated pursuant to the authority vested in the Board of Health under General Laws, Chapter 111, Section 122, which is to abate, contain, and prevent the public health nuisance of the contagious spread of COVID-19 and other infectious diseases. Any person who has been contacted by the North Andover Health Department who has tested positive for COVID-19 or been diagnosed with any other infectious disease shall isolate for a set amount of time as determined by the North Andover Health Department. So what this is, we do other types of isolation quarantine as well, not just COVID-19. So if there's an E. coli issue or a salmonella outbreak, say in a restaurant worker, we need to exclude them from their place of employment so it doesn't spread. If there's a TB infection, then we work with them on getting their medications, and they do have to isolate or quarantine, then we work with them on that as well. So this goes beyond COVID-19 and does go into other infectious diseases that we do have control over. Not any infectious disease, Joe. We talked about this earlier. It's more on any type of reportable infectious disease. So certain diseases are reportable to the state through your primary care physician or a lab if you have a blood test or any type of test that comes up with a certain type of disease. It's reported to the state and then reported to us, and then we take care of it and do whatever the follow-up steps are required. So this is just beyond COVID-19. To any person contacted by the North Health Department must disclose the names, addresses, and telephone numbers of all individuals with whom they have been in close contact with during their infectious period as determined by the Health Department, and shall also provide the address of all public areas, businesses, and other locations where they have been in that time. So, for instance, COVID-19 has a 48-hour infection period prior to the onset of symptoms, which is where we do our contact tracing. So, close contact is anybody you've been in contact with, which is within 6 feet for 15 minutes or over, for 15 minutes or over if you are not wearing masks, not social distancing, things like that. So that's what we're kind of looking for in terms of a close contact. And we kind of go from there. So all persons determined to be a close contact of an infectious person must quarantine for 14 days or a set amount of time as determined by the health department. Different diseases such as hepatitis C versus COVID-19 have different infection periods. So what that is if you are exposed to COVID-19, it can take up to 14 days to actually show symptoms, or become infectious. So that is set by COVID-19, where as hepatitis A has a different infection or incubation period where it's going to go, say, maybe 21 days. So we will definitely take a look at that depending on which disease it is and what the criteria meet. And then the big thing is refusal to adhere to isolation and quarantine orders, provide such information required for contact tracing, or knowingly giving false information shall be punishable of a fine of up to $1,000 in accordance with Mass General Laws, Chapter 111, Section 123, which is the abatement clause in the Mass General Law, Chapter 111 that we talked about. Each say a portion thereof that a violation of these regulations shall constitute a separate offense. It's going to be up to $1,000 a day. And then severability clause at the end, just if anything is found to be deemed invalid, the remainder regulation shall remain in full force. So I sent these out to you guys earlier. If you guys want to have any questions or talk about it at any more given length, then let me know and we can discuss it. And that is it. Quick one-page regulation. We can adopt it tonight. The public hearing has been posted for 48 hours and we are good to go. So that's all I got.
This is Joe. I talked briefly with Brian earlier this week about a number of things, and he did clarify 2 points in this new regulation. And I asked him to expand upon them, which he did. The points are infectious disease and also close contact. So I think Memos is well written, certainly makes sense. I don't have a problem, but I want to hear what the other members of the board have to say.
It's Pat. I don't have any issues with it. I do have to step off if everybody else felt it was appropriate to go for a vote.
Well, if no one has a problem with this, and because you have to step off in just a moment, need a motion.
I'll make the motion.
Motion to
as is.
Motion to approve this regulation as is. Is there a second?
Second.
Okay. All those in favor, say aye.
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 Okay. Regulation is approved. Good work, Brian.
Thank you very much. Appreciate that.
All right, everybody. I'm stepping off. Good work, Brian. Thanks.
Thanks, Pat. Appreciate it. If you need anything, let me know. Okay.
Sounds good. Thanks.
All right. Talk to you soon.
Bye.
All right. So I guess they're passed. Thank you, guys. I appreciate it. It just gives us a little bit of teeth. If anybody does give us pushback, at least we can say, if you don't cooperate, then there is an actual fine we can issue. We don't want to issue any fines, obviously. We just want to get the information we need to do what we need to do. So we're putting in a lot of hours doing all of this stuff. And to get pushback or not encounter people that are uncooperative is just frustrating. So this is good. At least we have something to fall back on if they don't want to cooperate. I think that is pretty much it. Are you guys all set? Anything else from me? If not, we can call it a night. Quick one.
Brian, this is Max. Can you clarify one thing for me?
Sure.
I'm trying to understand the concept of enforcement and citation with this regulation. Is that all through the Board of Health, or who's in charge of that?
I would be in charge of that, but it's under your authority. So Mass General Laws gives the Board of Health the authority to issue fines if somebody is not abating a nuisance or cause of sickness. So as your professional staff in your health department, under your authority, I can issue a fine for up to $1,000 for violation of this regulation or the Mass General Law that we would typically use for nuisance violations.
And in terms of reporting, Brian, how do you find out about that? Are these things that someone is resistant? So specifically, as you were discussing before, someone is resistant to being sort of forthcoming about contacts, or how are you going to?
Yes.
How are you going to?
Yep. Yeah. So we get, obviously, reportable disease. COVID-19 is reported. So the state gets a lab result of a positive patient. That information comes directly to us. We reach out and talk to the person to find out who they're with and what their situation was. So we get the lab date. We talk to them, find out when their symptoms were onset. We know when they tested positive. We go back 48 hours and basically do the contact tracing from that point. to find out where they were and what they were doing. So, for instance, if you were a coach of a softball team or basketball team or hockey team or whatever it was, we'd be like, okay, well, did you have practice? Did you have games? Well, yeah, we had 3 practices this week while I was infectious. Oh, okay, great. Or I went to 2 birthday parties. Oh, awesome. So we need to know where you went and who the birthday party was for and who was there, so we can reach out to them. Be like, hey, look, you may be considered a close contact. We're going to need you to quarantine for 14 days. So, and that gets all put into the Maven, which is the database cluster software that we have that basically does the umbrella of this infection, these close contacts, and then if anybody needs to get tested or comes down with symptoms, you can track it all back to that one case. So if somebody won't give us that information when we ask for it, like, okay, so you're the coach of a team, can I have the roster so we can talk to all the players? And they say, yeah, I'll get that to you later. Well, time is kind of the essence here, because if you infected somebody 2 days ago, they can become infectious and start infecting other people, and then it goes to their other sports teams, school, things like that. So Boy Scouts, Girl Scouts, everything in between. So if somebody's going to be resistant to give us the roster, or they play a game, say we'll get it to you tomorrow, I don't have it with me, and then they don't return your phone calls or your emails and don't call you back, then it gets really frustrating, because we're trying to do something that's time sensitive and they're not respecting that, which puts other people in harm's way. Make
Great.
sense?
Absolutely. Thanks, Brian.
As noted, there has been an uptick in coronavirus cases, and looking at some federal stats, a 10% increase in deaths over the last 2 weeks. And right now it's averaging about 794 deaths a day. Infection rising in 47 states, 8.6 million people have been affected, 225,000 people have died. And that death number, it is conceivable that it could double by February. Now, there may be a shot for this virus within 3 or 4 weeks or so, but it probably will not be made available to the public on a mass basis until the spring, so I have read. But having said that, it looks like some emergency people may get their shots early. So it's a race, because without a shot, it's going to be a rough winter, and that's why we still have to have these meetings virtual, which no one likes, but we have to do it. It is what it is. So these numbers are scary, very scary. Other comments at all?
So I would just make the comment, the numbers in North Andover are scary. It's important to recognize that neighboring communities are equally in the same boat that we are. In the Lawrence Stop the Spread tent, they're doing 1,100 COVID tests daily for Lawrence and the surrounding communities, with a really extensive contact tracing system there. So, Brian, your memo is equally important for those patients those people who are infected and get notice from Lawrence. The Lawrence prevalence right now is 13%. It's very high, and we are a neighboring community to Lawrence. So, and there is no magic boundary between towns. It's not like when Lawrence hits North Andover that it stops. We all shop in the same places, eat in the same places, rub elbows with everybody. We are one community. So this is extraordinarily important to maintain the vigilance that you are, Brian. So thanks a lot for all the work.
Thanks, Max. I appreciate that. What do you think,
Other
Joe?
comment? If there are no other comments, need a motion.
Come on, Michelle. This is usually your motion.
I seconded it. I was
All right. So Max made the motion. Michelle seconded
letting
it.
someone else make a motion.
All those in favor say
Aye.
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 Motion for adjournment is approved. Have a good evening.